Sharing Christ, sharing life, Blessed Hope Broadcasting Services.
Good evening, everyone. Welcome to 15th Annual Convention at Blessed Hope in London. My name is Owolabi-Makinde. I'm going to present a topic called Understanding Stroke. What is a stroke? A stroke occurs when blood flows to part of the brain is interrupted or sudden bleeding in the brain. Brain cells begin to die within minutes. Over 100,000 strokes in the UK every year. One person has a stroke every 5 minutes. Stroke causes around 34,000 deaths a year in the UK alone and are the single biggest cause of severe disability. Types of stroke. Ischemic stroke is a blockage in an artery in the brain caused by a blood clot or fatty deposits. Hemorrhagic stroke is caused by bleeding in the brain when a blood vessel bursts. Transient ischemic attack, which is a mini stroke or warning strokes. It lasts only for a short time, minutes or up to an hour. Causes and risk factors: high blood pressure, atrial fibrillation, which is the same as irregular or fast heartbeats, diabetes, smoking, alcohol consumption, high cholesterol, obesity, family history, cocaine and other illicit drugs. Others are standing up too quickly after sitting or lying down, which can cause a sudden drop in blood pressure, reducing blood flow to the brain and increasing the risk of stroke. Always sit on the edge of your bed for a few minutes to avoid all this problem of blood flow to the brain. Hot showers. Hot showers can cause heavy sweating, which can lead to dehydration, making the blood thicker, and clots, which may cause loss of balance. Start wetting yourself from your feet and then gradually to the top to avoid this. Weather factors such as cold seasons, these are related to an increased number of having strokes as well. Signs and symptoms. FAST. FAST stands for face, arms, speech, and time. Face. There's always drooping on one side of the face. Arms. There's always weakness, numbness, arm or leg on one side of the body. Speech. Difficulty in speaking or understanding what people are saying. Time. That shows that's the time to call for emergency support. Other signs are confusion, trouble seeing, loss of balance, dizziness, sudden or severe headache, loss of consciousness, and so on. What do you do in a stroke emergency? You should call 999 or emergency services immediately. Note the time symptoms started so you can hand over to ambulance. Keep the person safe and comfortable. Please do not give food, drink, or medication unless you are advised to do so. Complications after a stroke are lack of concentration, difficulty to read and understand, difficulty in writing and speaking, difficulty in swallowing, poor mobility and hearing, epilepsy, numbness, and weakness on body and face. Diagnosis, treatments, and rehabilitation. To diagnose stroke, CT scan is needed, CT scan and MRI scan of the head. Physical examination should include blood pressure and heart rate monitoring. Listen to carotid arteries, and you need to apply fast approach and then to do blood test. Treatment. Ischemic stroke, the treatment includes anticoagulants such as warfarin, heparin, aspirin, or clopidogrel, and so on. Hemorrhagic stroke includes open skull surgery for evacuation of the blood clots, and control of the blood pressure is essential. Rehabilitation, it includes speech therapy, physical therapy, occupational therapy, psychologist input for depression and low mood. Preventing stroke. How can we prevent stroke? We need to take care of our body because our body is a temple of God. We need to manage our blood pressure, diabetes, and cholesterol. We need to eat healthy diets at home, not only at home, even at church and everywhere we go. Our food should include fruits, veg, and low-salt diets. Exercise regularly. We need to do exercise. Even if it's brisk walking, it's very essential. We need to, if you smoke, you need to stop smoking. Avoid alcohol consumption. Take prescribed medications properly. You need to have regular checkups with your GP. Encourage community screenings and support. Most importantly, we need to offer spiritual care to stroke survivors and families. In summary, we need to make sure we recognize stroke signs fast. We need to live a healthy lifestyle, educate others in your family and church. Pray, support family and friends in recovery process. Thank you.
Sharing Christ, sharing life, Blessed Hope Broadcasting Services.